Another compelling reason for developing this faculty development focus on teacher training website was that for the last 30 to 40 years, we found in our Carnegie study that the education courses and the teacher preparation courses had all but dropped out of graduate nursing education. And of course, we have that recent Carnegie report saying that teaching graduate students in any discipline how to teach is the stewardship responsibility of the discipline. And we began to realize we had fallen down on that. And we're recommending a two-pronged preparation that all graduate students in nursing have a preparation to teach, even the undergraduate who will be responsible as a nurse to teach patients, families, communities, and even do clinical teaching in their roles. But especially graduate students should have more advanced preparation in teaching and learning how to develop a curriculum, and that's how we will be good stewards. I do recommend core courses in the advanced practice area for those who plan to teach, because it isn't as if we can just focus on teaching and let the content slip by. We need, and as Bain has demonstrated in his looking for the best teachers really have the most in-depth knowledge of their field. So in graduate education, we really want to take back the educational role, not make it a substitute for the very important work of advanced clinical practice and research, but teaching is a very high form of scholarship, as Aristotle pointed out a few years back. We need to bring back teacher education. I was at an NLN conference which really convinced me of the importance of this. I asked faculty in that large room of 2,000 nurse faculty to raise their hands if they had never had a formal class in teacher preparation. Really, about 3/4 of the audience raised their hands, and I think this shows, sort of anecdotally, but it does show that we've pushed and marginalized teacher preparation in our graduate schools. And I know AACN, American Colleges of Nursing, and NLN are both really encouraging schools to focus more on teacher preparation in their graduate program. So we hope to really contribute to that. The other thing that I hope you discover in looking at these teachers' accomplishments as really excellent teachers who've solved some of the major practical problems in domain-specific education is that I hope you will take pride in the excellent teaching that you can find in our discipline. And our goal is to show that excellence and really highlight it so we can make it much more contagious and widespread. As we go on, we'll have more on situated coaching, on clinical education, but right now we're focused on how to integrate those three essential apprenticeships for all practice discipline, the cognitive, the practice know-how, clinical reasoning, and the ethical comportment and ethical formation. No discipline can afford to outsource teacher preparation, because teacher preparation is really distinct for every different discipline, whether it be history or math or nursing or medicine. And if I had to say one specific signature pedagogy in nursing is really coaching and learning experientially in clinical situations, whether that be in the sim lab or in actual clinical practice. In any practice discipline, there is a real crisis in just always teaching one element at a time in order to make mastery more simple, because eventually the student, the practice nurse, will be required to enter an ambiguous, underdetermined clinical situation that's going to unfold across time. And so, in order to do that, you have to have experience with these unfolding situations. We know from the Carnegie study that we haven't adequately been teaching response-based practice, and yet nurses currently must titrate therapies, they must titrate medications, and so we really want to demonstrate teachers who prepare for situated thinking and action. Practice is not a mere application of technical implication. It is a dialogue. It is a situated, productive thinking and knowing in its own right. So one of our visions is to bring this dynamic together and demonstrate two practices: the very specific practice of nursing and the very specific practice of teaching nurses.